Hello everyone, my name is Lisa Green. I am currently enrolled at Lincoln Memorial University of Harrogate, Tennessee, and I am working toward my master's degree in nursing with a concentration of family nurse practitioner. Today I would like to discuss emerging roles of nurse practitioners that are of a particular interest to me, and the topic that I have chosen to discuss is cosmetic nursing or aesthetic nursing. Cosmetic or aesthetic nursing isn't just for women. Men, the same as women, can get any of the same treatments as women. Some of the activities and treatments that I have listed on the slides are just a few of what is actually available in cosmetic practice. The procedures listed here are the most popular procedures. Activities and treatments include micropigmentation or cosmetic tattooing, and then there's tattoo removal, injectable derma fillers, chemical peels, sun damage is big. According to the Skin Cancer Foundation, more people are diagnosed with skin cancer than all other cancers combined. Skin cancer is considered the most rapidly increasing malignancy in the United States, according to the CDC. Early detection by nurse practitioners are crucial for the survival of patients who are at risk for such malignancies. There's also photodynamic therapy, removal of skin lesions, microdermabrasion, wound care, and sclerotherapy. Nurse practitioners in cosmetic practice. After receiving graduate level training, clinical preparation, and obtaining certification to practice as an advanced practice nurse, NPs that are interested in cosmetic procedures can become certified as a certified aesthetic nurse specialist. Nurse practitioners have been diagnosing and managing medical conditions for over 50 years, and as the demand for cosmetic procedures continue to rise, the skills of trained medical NPs can take on new roles and responsibilities in dermatology, moving from the traditional setting to outpatient surgical centers and medical spas. I thought this picture was appropriate and was a good example that helps explain the theory of body image. The kitten that looks in the mirror and sees a lion. The kitten perceives himself a certain way. Body image is how a person perceives themselves, and it pertains to everyday life. The body image theory describes the more a person accepts themselves, the more secure the individual will become. Research has shown that not only is body image the way people see themselves, but how other people see them. Body image plays an important role in an individual's psychosocial and psychological well-being. Because body image is so important to a person's self-perception, it can be easily understood why people would seek improvements to the condition of their skin. Dermatology covers a vast variety of skin conditions other than lines and wrinkles. One of the advanced cosmetic procedures used by nurse practitioners would be the application of micropigmentation in women or men who have undergone breast reconstruction. The use of micropigmentation uses color pigments injected to the skin to recreate the natural look of the skin. Micropigmentation has become a role expansion for advanced practice nurses because these types of procedures were previously performed by medical doctors. In the following YouTube video, it will be a brief description of how the micropigmentation or tattoo is used in cosmetic practice. And as you'll be able to see the before and after pictures and how it will be able to be beneficial to a person's body image and self-esteem. According to the literature, a patient may choose a nurse over a doctor to perform micropigmentation because nurses boost patient confidence, they are more supportive, they are confident, and considerate a counselor. Evidence also suggests that women or men who seek treatment by micropigmentation recognize autonomy and shared decision-making with themselves and the nurse practitioner that's providing the service. As more advancements to minimally invasive cosmetic procedures are becoming excessively popular, the need for infection control best practices are a priority. With the new technology, nurse practitioners who work in dermatology use advanced training and medical knowledge to prevent skin infection by realizing each individual has a different skin type and may warrant prophylaxis antibiotic use. Strict pre- and post-operative care is given by the advanced practice nurse, including antibiotic use, proper dressing, topical ointments, careful watch of edema, sloughing, contact dermatitis, and distribution of prescriptions as needed. The use of carbon dioxide lasers to reduce wrinkle, line scarring, and other skin disorders have been used for years. The technology has changed from CO2 lasers that use lower wavelengths with less damage to the skin, and as the population continues to age, the use of CO2 lasers are becoming more popular. Most individuals are interested in keeping their youthful appearance, and the nurse practitioners are trained to respect the instruments used. Significance to advanced practice nurses. In the field of dermatology, the focus is on the skin, and it's the largest organ of the body. The skin tells a story of the condition of the body, and looking at the condition of the skin will give a wealth of information. So nurse practitioners with an interest in dermatology, this field is significant because more people are interested in staying younger and having healthier looking skin. Dermatology nurses observe, assess, and perform minimally invasive procedures. Minimally invasive procedures open doors for less invasive procedures instead of the expensive surgeries performed by medical doctors. This saves patients money. The use of laser skin care gives patients with scars and other skin conditions excellent outcomes. Injectable derma fillers such as Botox and Juvederm give patients the look of smoother skin and less wrinkles. Some of the challenges and current issues. As the nursing profession continues to add to the complementary part of cosmetic procedures and plastic surgery, the numbers of nurse practitioners establishing private practice has grown. There seems to be no input from nurses on how the standards are maintained and the safety of their clients. The evolving specialty of cosmetic and aesthetic procedures consists of wound care up to tattoo removal and should include a model of practice. With nurses being an important role for legislation and regulation, advanced practice nurses interested in cosmetic procedures must make their voice heard. Because the lack of regulation for nurse aestheticians, regulatory bodies to ensure safe practice should be welcomed. Nurses, doctors, and dentists are regulated by their own statutory bodies. The products used by cosmetic nurses are regulated, however, the training for practice is not provided by an accredited body. To provide documentation for practice, the Department of Health established voluntary self-regulations. Those who are not registered set their own standards. These standards include the health and safety, data protection, etc. of the clients. Nurse practitioners should be current on legislation, the standard of practice to ensure that the healthcare professionals with adequate training and education be able to continue to practice. Other challenges include a deficiency in dermatology education with no requirements for standardized dermatology curriculum. In conclusion, aesthetic nursing is a growing field aimed at enhancing a person's appearance. Nurse practitioners going into this field need skills such as assessment, critical thinkers, and be familiar with ethical practice. The specialty consists of an array of procedures aimed at a person's appearance that includes derma fillers, chemical peels, dermabrasions, and laser treatment. Caution must be used in regards to the use of the correct product with the correct application. Although no formal training is needed to become a cosmetic nurse, a master's level education, dermatology experience, and feeling comfortable with surgical instruments are important. Medical knowledge, new technologies, with a combination of pharmaceuticals and extensive knowledge of medical devices, crisscross the field of medicine. Advanced practice nurses are cost efficient and provide excellent outcomes. Individuals interested in dermatology should believe in themselves and use their influence to help patients with self-esteem issues related to their skin and their appearance. By realizing the skin tells us a lot about the condition of the health of a person. Our contribution in dermatology should not be taken lightly, because if we can help patients who have skin cancer or acne scars look and feel better, we have influenced the overall health of patients who suffer physically and mentally. Thank you for viewing this presentation.